So continuing with our examination of the appendicular skeleton, we'll now discuss the upper limbs. So there are 30 bones in each upper limb, making 60 bones total for the entire skeleton in both upper limbs. So we'll begin by making our way from proximal to distal on the upper limb bones, and starting at the proximal bone, we will examine the humerus first. The humerus is the bone of the arm region. The humerus articulates with the scapula at the shoulder. The head of the humerus, which is this rounded end that you see here, fits into that glenoid cavity that we saw on the scapula. And at the distal end of the humerus, we have these small little knob-like projections that articulate with the radius and ulna, and those form the elbow joint. This rounded end that's more laterally located here is called the capitulum, and the capitulum of the humerus articulates with the radial bone, or the bone that's called the radius in the forearm. And this more kind of hourglass-shaped structure here is called the trochlea, and the trochlea of the humerus is what articulates with the medial bone of the forearm, that's called the ulna. If we take a closer look at the elbow joint, we can see, this is the anterior view on the left and a posterior view on the right here. We can see the rounded capitulum of the humerus, which makes a joint with the head of the radius at the lateral part of the elbow joint. At the medial part of the elbow joint, we see the hourglass-shaped trochlea, which makes a articulation or joint with the ulna bone that's more medially located in the forearm there. Looking at the posterior part of the elbow joint here, we can see that the elbow itself is actually made, or the elbow itself is this process here that's called the olecranon. The olecranon is actually a projection that comes off of the ulna and not of the humerus. And so the thing that we're actually, or the object that we're actually feeling when we palpate our elbow or when we feel our elbow, is we're actually touching the olecranon of the ulna bone. So looking at kind of the remainder of the humerus, a couple of structures that we see on the lab list here, returning once again to the proximal end of the humerus, that is the end of the humerus that's in closest proximity to the shoulder joint here. We have these two large projections, a little bit distally located to the head of the humerus. They are called the greater tubercle, which is more laterally located, and the lesser tubercle, which is more medially located. These two tubercles, the greater and lesser tubercles, are sites of attachment for a group of muscles called the rotator cuff muscles. The rotator cuff muscles are a group of shoulder muscles that help to stabilize and support the shoulder joint, as well as provide movement at the shoulder joint as well. There is a small groove, or a groove that exists between the greater and lesser tubercles called the intertubercular sulcus, and this sulcus acts as a guide for a tendon from the biceps brachii muscle. So the biceps brachii muscle attaches to the shoulder. It sits mostly right here. Most of the mass of the biceps brachii muscle sits on the anterior part of the forearm, but it has tendons that run up to the shoulder, and so this little intertubercular sulcus provides a place for that tendon to sit so that it does not slip between different parts of the shoulder joint there. About midway down the humerus, as we kind of make our way distally towards the elbow joint, about halfway down the humerus, we see a little roughened patch on it that's called the deltoid tuberosity. The deltoid tuberosity is a site of attachment for a triangular muscle on the lateral part of the shoulder called the deltoid muscle. So now that we've explored the proximal part of the humerus, let's turn our attention briefly to the distal part of the humerus again, closest to the elbow joint. Recall that the capitulum, which is the rounded articulating facet that receives the radius bone, is more laterally located, while the trochlea, which is more kind of hourglass shaped, is located more medially, and the trochlea receives the ulna bone at the medial part of the elbow joint. We see just above the trochlea is a small depression that's called the coronoid fossa, and it fits. That coronoid fossa allows for the ulna to sit, or part of the ulna to sit within that fossa when the elbow is flexed, and so that little depression, that little fossa, helps to fit the ulna when the forearm is flexed, when the elbow is flexed, and so that provides a little place for part of the ulna to sit. And allow the ulna its full range of movement at the elbow joint. Looking more medially, we see this kind of large knob-like projection that's called the medial epicondyle. It's a site of muscle attachment, and it can actually be palpated quite easily. That is, it can be felt quite easily at the elbow joint. So if you extend your elbow and you kind of move your fingers or your hand towards the medial part of the elbow joint, that is the part of the elbow joint that's closest to your midline, you can actually feel that large medial epicondyle projecting from the medial part of the joint there. If you're feeling the very back part of the elbow, you're feeling you have your fingers or your hand on the olecranon, which is part of the ulna. But the medial epicondyle is part of the humerus, and that is very easily palpated through the skin at the elbow joint. Turning our attention to the posterior distal side of the humerus. So essentially what we've done is we've turned that diagram around and we're now looking at the back side of it. We see, instead of a couple of little depressions in it, we see one large depression in it that's called the olecranon fossa. And the olecranon fossa is a place for the ulna to sit when the elbow is extended. So that is when there's roughly a 180 degree angle at the elbow joint when your forearm is fully extended. The elbow joint actually locks into that, and you can actually feel the ulna locking into that as your forearm extends. And so that olecranon fossa is a place for the ulna to rest when the elbow is extended. The lateral epicondyle is also much more easily seen from the posterior view. So the lateral epicondyle is another site of muscle attachment, but we really couldn't see it from the front, from the anterior side, because the capitulum, which articulates with the radius, really kind of obscures most of our viewpoint of it. Again, we do see the medial epicondyle from the posterior side, but we saw that from the anterior side, and that's what we were palpating at the elbow joint just a few moments ago. So that summarizes our tour of the humerus. Let's now continue more distally as we make our way through the antebrachium, or the forearm, where we see two bones in parallel. We see the radius and the ulna. The radius is in anatomical position, of course. The radius is the laterally located bone. And the radius is actually what contributes mostly to the movement of the wrist. And so when your forearm and your wrist are rotating, it's actually the radius that's doing the majority of that rotating and causing that rotational movement of the wrist and the hand. Well, the ulna is actually the medially located bone in the forearm or the antebrachium in anatomical position. And the ulna contributes mostly to the movement of the elbow joints. So we'll see a series of structures at the proximal end of the ulna that really help secure the ulna to the humerus. So in looking at the proximal parts of the radius and the ulna, that is, these are the parts that make up the elbow joint here, we see that the radius has a rounded head region that's simply called the head of the radius, and the head of the radius articulates with the capitulum that we see on the humerus. Capitulum actually just means head, or it's another term that means head, so it makes sense that the head of the radius articulates with essentially a head-like structure on the humerus, so head and head come together. On the ulna, I should say, we see, instead of a rounded head region, we actually see kind of this like C-shaped, almost like wrench-like looking structure associated with it. The trochlear notch is this C-shaped notch that's on the proximal part of the ulna, and that trochlear notch articulates with, very conveniently, the structure called the trochlea on the humerus. So the trochlear notch or I should say the trochlea on the humerus receives the trochlear notch on the ulna. We also see in this diagram here, now that we've kind of zoomed in a little bit, we see the coronoid process and the olecranon or the olecranon process that help to really form a clasp or a kind of wrench-like grip on the trochlea of the humerus, so that way that the ulna does not slip out of place when the elbow joint is going through its normal range of motion. So both of these structures help contribute to that kind of C-shaped cup that we see at the end of the ulna. And moving a little bit distally down the forearm bones here, on the radius we have a little bony projection, a little bony rough patch. That's referred to as the radial tuberosity, and the radial tuberosity is the site of attachment for the biceps brachii muscle that crosses the elbow joint and causes flexion of the forearm when it contracts. We'll talk more about the terms flexion and extension and things like that in Chapter 8 when we get there. But a flexion movement would be any time that the elbow is experiencing an angle that's less than 180 degrees, that is, it's less than straight. And of course, the biceps brachii muscle is the large muscle that sits on the anterior part of the arm. So now that we've looked at the proximal parts of the radius and the ulna, let's turn our attention briefly to the distal parts of the ulna. That is the radius and the ulna. That is, these are the parts that form the wrist joint, or part of the wrist joint here. So again, we have the radius on the lateral side, the ulna on the medial side, and you'll see that their distal ends look quite different from one another. The radius has an almost triangular, very blunted distal end, whereas the ulna has a small, little rounded end. And this is actually the head of the ulna, so you may think that the trochlea and the trochlear notch and the olecranon were actually the head of the ulna, but it turns out that the head of the ulna is actually at the wrist joint. So in that regard, the radius and the ulna are kind of flipped with respect to one another, since we saw the head of the radius at the elbow joint and the head of the ulna is at the wrist joint. At the ends of the radius and the ulna, we see a small pointed projection called the radial styloid process at the wrist joint, or I should say where the radius meets the wrist joint, and where the ulna meets the wrist joint, we have another small projection that's called the ulnar styloid process. And together, these radial and ulnar styloid processes are attachment points for ligaments that run down the forearm and to the wrist. You can actually palpate both of these at the wrist joint there. So if you follow the radius and the ulna downward, usually right where the radius and ulna meet the wrist joint, you can kind of push your fingers into the wrist, and you can actually palpate both the ulnar and radial styloid processes. Not as easy as that medial epicondyle of the humerus, but they're still easily able to be palpated there. So now that we have explored the structures of the forearm or the antebrachium, let's take a look briefly at the bones that are forming the hand. Now, the hand is constructed from bones located in three major regions, or that are part of three major regions. We have the wrist bones here, which are collectively called the carpals, the bones of the palm, which are collectively called the metacarpals, and the bones of the fingers, which are collectively referred to as the phalanges. If we turn our attention to the carpals, or the wrist bones, we see that there are 8 carpal bones in each wrist, and these 8 bones form 2 rows with roughly 4 bones per row. The rows, they're not quite as clean cut as two individual rows, but for the most part we have a row here and a row here, and there's 4 bones per row. You see that each carpal bone has its own unique name, but the only carpal bone that we will focus on is this bone right here, and that's called the trapezium. And this is a carpal bone that makes a joint or articulation with this first metacarpal here. And the reason that we learn this one is because this one contributes to a special movement of the first metacarpal and the thumb, and we'll explore that in Chapter 8 when we get to it. So those are the carpal bones, again with the one named carpal bone that we will focus on your lab list. That's called the trapezium. The other ones, yes, do have unique names and locations on the wrist, but you do not need to burden yourself with learning their names right now. So those are the carpal bones. Let's turn our attention now to the metacarpals. Right? The metacarpals are the bones of the palm. Their name actually means beyond the carpals, since this word meta means beyond. So these bones are literally named beyond the carpal bones. These have numbers rather than unique names, and they are numbered with Roman numerals. So this is Roman numeral 1, 2, 3, 4, and 5, which is the V at the very end of the metacarpal bones. You'll notice that metacarpal 1 is the metacarpal that makes a joint with the phalanges that belong to the thumb. And so the first metacarpal is always at the base of the thumb. The fifth metacarpal is always at the base of the little finger. So the way that the metacarpals are named is simply metacarpal 1, metacarpal 2, which is metacarpal 2 is at the base of the index finger, metacarpal 3 is at the base of the middle finger, metacarpal 4 at the base of the ring finger, and metacarpal 5 is at the base of the pinky or the small finger. So let's take a look, now that we've explored the carpals and the metacarpals. Now let's kind of dive into the individual phalanges. And it turns out that naming the individual phalanges is fairly straightforward. There are 14 individual phalange bones per hand, so that's 28 total in the entire skeleton. And their naming is actually fairly straightforward, even though the diagram in the book I don't think does a great job of describing how to name these. So they're named, their name is kind of a combination of two things. They are named by the number of the metacarpal that they articulate with, and the position of the phalange bone with respect to the metacarpal bones themselves. And we call these individual phalanges, we call them phalanx, because this is the singular form of phalange. So the phalanges at the distal tips of the fingers, that is the ones that are just deep to the fingernails, are called the distal phalanges, or if you're just talking about one, it'd be the distal phalanx. Well, the phalanges that form the joints with the metacarpals are called the proximal phalanges, or if you're just referring to one, it would be the proximal phalanx. The phalanges that are located between these two bones are called the middle phalanx. I want you to notice here that we only have a proximal and a distal phalanx 1. We don't actually have a middle phalanx 1. The numbering for the phalanges here follows the exact same numbering scheme as the metacarpals. So these would be the first phalanges, these would be the second phalanges, third phalanges, fourth phalanges, and fifth phalanges. So now that we know that the phalanges are named by their position with respect to the metacarpal, as well as the number of the digits that they're located on, let's put those together and see how they're named. So let's do some practice naming for the phalanges here. So this one right here, these are the metacarpals here in blue, just so you can easily see which bones we're looking at here, and the phalanges are highlighted in orange here, and I've conveniently also put their numbers, the number of the digit in Roman numerals again, above each digit here. This bone right here, which makes a connection with our first metacarpal here, is called proximal phalanx 1 because it is the bone that makes a direct connection or joint with the metacarpal, so therefore it is proximally located, and because it's located on the first digit, we call it proximal phalanx 1. This one that's at the very tip of the thumb, that is just underneath the thumbnail, is referred to as distal phalanx 1 because it is the furthest bone in that particular digit, and it's still part of the first digit, so we call it distal phalanx number 1. The same goes for naming the digits of the index finger here. So we have a proximal phalanx 2 that's connected to our second metacarpal here. We have a distal phalanx 2 that's located underneath the fingernail of our index finger. But in this case, we have a middle phalanx because we have a third bone here that's between the distal and proximal phalanx here. So this one would be referred to as middle phalanx number 2. Notice we don't have a middle phalanx 1 because there were only 2 bones in the thumb and not 3 bones. We would follow the same numbering and naming scheme for the remaining digits, that is for the middle finger, the ring finger, and the pinky. So this bone in the middle part of the pinky would be called middle phalanx 5. This bone at the base of the ring finger here, that makes a joint with our fourth metacarpal. This would be called proximal phalanx number 4. And the bone that's at the very tip of the middle finger would be called distal phalanx number 3. So that just gives you a pretty quick and easy example of how you name all of the phalanges in both hands. Once you familiarize yourself with this naming scheme, it makes learning the names of the toes much easier as well, because the toes follow the exact same naming rules that we have seen here